Welcome back, where we are celebrating Women's Small Business Month. Our next guest specializes in treating common issues that occur throughout a woman's lifespan, and they believe women should be able to run without leaking, play with their kids without pain, and enjoy intimacy with their partner as well. Joining me now is Dr. Brenda Heineke with Revitalize Physical Therapy. Good to see you, doctor.
Hi there. Thanks for having me today.
Absolutely. I personally love this topic. I think girlfriends talk about it amongst each other, but it's not talked about enough. And people need to normalize this conversation. So let's talk a little bit about what a woman's assessment entails with you guys and exactly what you do.
Sure. So we essentially work a lot with women of different stages of their life and working a lot with common issues that they might experience, like incontinence, pelvic pain, prolapse or pelvic pressure, just to name a few. And so typically all of those things entail the pelvic floor. And so when we work with women to do a women's health assessment, we're kind of looking not just at the pelvic floor, but the whole body. So we start off kind of working a little bit with what is their posture, what are their movements like. So if we have someone that has pain when they're bending over to pick something up, we want to look at that. And then we're going to dive a little bit deeper into their range of motion, their strength, and then looking at the pelvic floor itself. And in order to look at the pelvic floor, the most ideal way is to do an internal intravaginal assessment. If women aren't comfortable with that, we definitely work within their comfort zone. And so we can work externally as well, but we want to know exactly what the muscles are doing. Are they contracting? Are they coordinated? And oftentimes people think that they just need to do more Kegels or that the pelvic floor muscles are weak. And that's oftentimes not the case. So we want to know exactly what's going on so that we can then create a plan of care tailored specifically for their needs.
I love the fact that you even mentioned the Kegels, because I think, people talk about that a lot. Oh, if you just do that, or, don't go to the bathroom while you're standing up in the shower, different things that can weaken some of those muscles, we think, oh, then you'll be fine. And I think a lot of people think that leaking when you're running, laughing, sneezing is normal as a part of aging. Is it?
No, so that's a really common misconception. A lot of people think that incontinence is normal, and you'll hear people say, oh, you just had a baby, or oh, you're just getting older. That's just normal. And it's not. Even though it's very, very common, 76% of women struggle with incontinence, and it's not something you have to deal with. So the guidelines is any leaking at any point other than your first 6 weeks postpartum is considered abnormal. So that means sneezing, coughing, running, jumping. You should be able to do all of that without leaking.
That's going to surprise a lot of people. And they're going to say, oh, because it can start young. I mean, I've got friends who've been talking about it since we were in our 30s, and I think it's just something women accept and they don't have to. How about pain with intercourse? Because that's another thing. People will say, well, again, maybe it's perimenopause or it's just because I had a baby. Is that normal?
Yeah, no, that's one of the things that I tend to get a little bit on my soapbox about, because we have so many women coming into the office here that have been suffering for months, if not years, and that can really impact quality of life. We have women that are maybe on the brink of divorce because they haven't been able to have sex for years. And so it shouldn't be painful at any point. So we always tell people that, sometimes, especially after baby, if you have scar tissue there, oftentimes that's painful. And we want to break that up and get rid of it so that the tissue can actually stretch and expand how it needs to. And then as you start to have some hormone changes closer into perimenopause, it can give not just a dryness issue, but it actually kind of starts to decrease your muscle mass. And so oftentimes women are told, oh, you just need to relax more, use more lubricant, have another glass of wine. And all of those excuses, if you will, or advice is not really what we want to be giving, because they oftentimes there's a actual reason for the pain, and it's not just you need to relax more. And so oftentimes too, women will be given maybe like an estrogen cream that can sometimes help with the dryness. But I always tell people, if that isn't helping and you don't notice an improvement pretty quickly, then it's time to look at other options. Don't just suffer through and think that more time is going to help it get better.
I would think so many women would feel so comfortable chatting with you because it's like you give us permission. It's not your fault. You don't need to just have another glass of wine and relax. I mean, to know that that's the advice we're giving women is just, I mean, that's heartbreaking because it makes you feel like you're responsible for not feeling comfortable. And that's just not true. So we ran out of time, but I want to give the information so everybody can contact you because I think just meeting with you and talking through this can help normalize it and know that you're not alone. So I loved this conversation. Thanks for joining me today.
Yeah, thank you so much for having me.
Absolutely. And here's the details. Right now, Revitalize Physical Therapy is offering a 30-minute women's health assessment. It's just $47. That's how you can talk to Dr. Brenda Heineke. You can call her at 414-708-8066 to schedule your appointment. Or for more information, the website on your screen, which is revitalize-pt.com.